more techniques would be, again, if you go with less lotion, horizontal friction can become heating. So if I do it now and he has very little lotion, I'm sure he feels almost immediately heat. Okay, so you can do a horizontal for heating. You can do on the border, up and down. Hold on. So those are the main heating techniques. Now you can do then specific friction techniques. So that would be to a pinpoint area. So let's say in his paraspinals, I want to work on a particular area. Maybe there's an adhesion around a facet joint. Okay, and I'm feeling deep inside, gee, there seems to be some fibrous tissue there, and I want to work on it. And I'm feeling that the fibrous tissue is moving in this direction. Okay, so I can do. Now, when you're doing friction, what you want to do is you're pinning the top tissue down. So I'm not that's a superficial friction. For deep friction, I have to pin that tissue down and rub underneath it. So there's a difference between what I'm doing now and that. You see? So I'm pinning down and moving the tissue underneath it against the subcutaneous tissue, or I'm sliding over the subcutaneous tissue. So two different techniques. So here, if I wanted to do horizontal friction over deeper tissue, sorry, I think I'm over it. That can't feel good. I kind of pin in deep, and this is horizontal friction. Okay, I'm moving along the direction of the friction. I can do a circle over that area, or I can do cross friction, which would be the opposite, perpendicular to the fibers. Okay. So those are three techniques. Now, in general, we use those techniques. It's usually in a superficial joint area over a tendon or a ligament. So I'm going to show you like a lateral epicondylitis, because that's typically what you're using it for. You can use it for supraspinatus tendonitis. You can use it for iliotibial band syndrome. Okay. So those are localized areas where you can actually palpate the area, ligament, tendon that you want to work with. Okay, so I'm going to have you, slide you back up here. That didn't sound good. At all. You sit on up. And now we're going to look at the typical, and you can actually sit in the chair. So let's grab him a chair. Somebody Just put it on the floor.
Okay.
And so you might need to move up. I'm just going to grab this just in case. You might want to kind of come up here. Let's see. Dang it. So you don't want too much. So depending on, you would palpate where he was having pain. So let's say we're going to work on this right here. He's got a little trigger area. So I would start with a light stroking. Now as the lotion goes away, now I'm getting into a deeper, now this would be horizontal. And then for cross, then now I'm kind of, that's cross. I'm going across. Now typically you want it in a relaxed position, so I would have something supporting his hand. Okay, up like that, so that it's not tense, because I'm pressing a lot, and it's probably not real comfortable for him. And so I don't want to be doing it in a lengthened position. That's going to make it even more uncomfortable. Okay, so nice relaxed position. And you're just going back and forth over the tendon. You can slide a little on the skin, but really you need to be kind of going back and forth across that tendon. And it's not comfortable. It really isn't. Okay. So again, you find the area, maybe it's up here, depending on where the restriction is. Okay, in the shoulder. It might be on the insertion of the supraspinatus. The way to expose that actually is to put the arm behind the back and just relax it down. There. That actually pokes it out from underneath the acromion. Okay. And again, you start superficial and get deeper and deeper. And it will get red, and they will feel at first, oh, that's it's uncomfortable. And then over time, you actually begin to feel like it's going numb. And so you're not feeling as much discomfort anymore. And usually that's your treatment. That's when you're done. It's kind of like ice. When you get to that place and it's not as tender anymore, you can stop. But this is something that you have to work into. So usually if it's a 5 to 10 minute treatment, and you're going to be doing it for 10 minutes, you might do 2 or 3 minutes of effleurage. And you start with maybe 2 minutes of cross-friction massage. And then the next time maybe you can do 3 minutes of cross-friction massage. And then you go up from there into a chronic. You could teach people to do this themselves if it's working, if they can work on it themselves. You can do it to the iliotibial band. What position do you think would be a good position for that?
Sideline.
Sideline with the leg supported so it's relaxed. And then as you get more tissue response and less pain, I can lengthen it and actually take a pillow away. I'm not talking about the same treatment. I'm talking about in a week.
When you do the Icy-Man, are you picking a point or working along it?
No, you pick a point.
Okay.
You pick an area. Usually it's towards the insertion point. It's snapping back and forth across the leg.
Okay.
So that's where you usually pick to work. Okay. And again, it's uncomfortable. So you start off light, and then over time, as they tolerate, you can progress deeper. Okay. So that's cross friction. If I'm going in the direction, then it's horizontal friction, or I can do little circles. And usually you're doing kind of a mix of everything. Any questions? Just remember, pick an area. Please don't hurt each other.